Hi, my name is Deidriel Bailey, and in this presentation, we will be discussing the renin-angiotensin-aldosterone system and its effect on blood pressure. Let's begin by discussing what the renin-angiotensin-aldosterone system is. The renin-angiotensin-aldosterone system is a hormonal system that works to regulate blood pressure and fluid balance within the body. This system regulates the body's blood pressure by balancing electrolytes and fluid levels. This system also regulates the absorption of sodium and water within the kidneys. The renin-angiotensin-aldosterone system becomes active when there is a drop in blood pressure. When this occurs, the system will increase the reabsorption of water and electrolytes within the kidneys, causing the blood pressure to increase. Now that we know what this system is, let's discuss the three hormones that make up this system. Renin is the hormone involved in the first stage of the renin-angiotensin-aldosterone system. In the first stage of this system, renin is released from granular cells because of one of three reasons. This hormone can be released due to reduced sodium delivery to the distal convoluted tubule, reduced perfusion pressure in the kidney, or sympathetic stimulation of the juxtaglomerular apparatus. Adrenasergic peptide inhibits the release of renin. Now that we have discussed this hormone, let's discuss the next hormone involved in this system, angiotensin II. The protein angiotensin is produced by the liver. The protein cleaves to the hormone renin, which produces angiotensin I. The angiotensin converting enzyme then converts angiotensin I into angiotensin II, which is the main peptide of the system. This conversion typically occurs within the lungs. Once angiotensin II is produced, it binds to various receptors within the body. Most action involving angiotensin II involves the receptor AT1. This bond can result in actions such as inflammation or constriction. Angiotensin II also has the ability to act on the brain. It can bind to the hypothalamus, stimulating thirst. The secretion of vasopressin is stimulated when angiotensin II acts on the pituitary gland. Angiotensin II can affect several systems throughout the body. We have already discussed how it can affect the cardiovascular system, resulting in constriction, and the nervous system, stimulating the sensation of thirst. Angiotensin II can also affect the urinary system by acting on the kidneys. This act can lead to effects such as afferent and efferent arterial constriction and an increase of sodium reabsorption. Angiotensin II also aids in the stability of glomerular filtration rates. Let us now discuss the final hormone involved in this system, aldosterone. Aldosterone is released when angiotensin II acts on the adrenal cortex. Aldosterone acts on the principal cells of the nephron and increases the way in which apical epithelial sodium channels are expressed. This is important in the reabsorption of urinary sodium. When additional sodium is reabsorbed through this channel and into the sodium-potassium pump, Potassium is moved into the principal cell of the nephron from the blood and exits through the renal tubule. The potassium would then exit the body through urine. When there is an increase of aldosterone levels, there will be a decrease of potassium within the blood. Before we discuss how the renin-angiotensin-aldosterone system affects blood pressure, let's discuss the basics of blood pressure. Blood pressure is a representation of how the blood pushes against the walls of the arteries. These arteries then carry the blood from the heart to the rest of the body. Two numbers measure the blood pressure. The systolic blood pressure is the first number, which measures the pressure within the arteries as the heart beats. The second number, also known as the diastolic blood pressure, represents the pressure in the arteries as the heart rests between beats. Now that we know what blood pressure is, let's discuss how the system affects it. The renin-angiotensin-aldosterone system works to regulate blood pressure. Renin, the first stage of the system, aids in blood pressure regulation by becoming released when cells of the kidney detect a drop in blood pressure. Angiotensin II causes the blood vessels to constrict which increases blood pressure. Aldosterone, the final hormone involved in this system, acts to increase blood pressure. This occurs due to the kidney's ability to retain salts and water, which allows the body to increase the amount of fluid in it. Secondary hypertension is a result of hormonal imbalances within this system. The development of several drugs that treat hypertension are a direct result of knowledge based on this system. For example, diuretics or water pills help the body get rid of fluid by excreting water and sodium through urine. Research was conducted in order to show the detrimental effect of an imbalance within the renin-angiotensin-aldosterone system. This system showed that an imbalance within this system can have effects on other health issues other than high blood pressure. Clinical trials were performed in order to determine whether an intervention of the system in patients with hypertension would lower the morbidity, mortality, and marker levels. The interventions were based in comparison to patients given placebos. Hypertension affects 25% of the nation worldwide, and it's believed that this number will gradually increase. Treatment options such as lifestyle changes and drug therapy are implemented, but detrimental effects can result when the underlying cause isn't treated. The cause of most atrial hypertension cases are unknown. When the renin-angiotensin-aldosterone system is compromised, this produces modifications within the blood pressure. Drugs that were developed from this system have been beneficial in treating more than high blood pressure, and the research shows how its molecule produces in-organ damage because of high blood pressure. The randomized aldolcone evaluation study, or RAILS, and eplerenone post-acute myocardial infarction heart and survival study, or EPHASIS, demonstrated the reduced risk of morbidity or mortality patients who were treated with MR, or mineralocorticoid receptor antagonists, along with standard therapy. This was done by conducting research on those with severe heart failure and acute myocardial infarction and the role played by MR antagonists. Another study evaluated the effectiveness of ACE inhibitors in addition to diuretics or beta blockers in patients with hypertension. The study concluded that there was no significant difference in morbidity and mortality, and that other drugs equally treated hypertension. There was research also conducted with the use of animal models, which showed how the use of toll-like receptors can effectively aid in the treatment of fibrosis in animals that were hypertensive. Research was also conducted based on kidney damage and complications of the vascular system. These studies showed that renin, angiotensin, aldosterone system molecules can be valuable in the treatment of these diseases. Overall, this study showed that the renin, angiotensin, aldosterone system molecules are important in treating hypertension as well as aiding in the preservation of other organs. Because of this, the development of drugs is underway in order to reduce the effects of arterial hypertension and to treat other issues in order to control an imbalance of the system. When there is a dysfunction within the system, complications such as chronic hypertension, kidney or cardiac failure may arise. Chronic hypertension can lead to other serious complications such as heart attack or stroke. Kidney and cardiac failures are the result of imbalances within the system. Although dysfunctions of the system can lead to serious complications, there are treatment options. ACE inhibitors are one of the treatment options used in order to treat and manage hypertension and heart failure by preventing the conversion of angiotensin I to angiotensin II. Angiotensin receptor blockers aid in the management of heart failure by blocking the binding of angiotensin II to ATRs. Both ACE inhibitors and angiotensin receptor blockers aid in treatment of kidney failure by limiting renal arterial stenosis. Renal arterial stenosis causes the blood volume which enters the kidneys to decrease. Limiting arterial stenosis will limit the inappropriate activation of the renin, angiotensin, aldosterone system. In this presentation, we discussed the renin, angiotensin, aldosterone system, the hormones involved in this system, research based on this system, and we discussed how this system can affect blood pressure. Thank you.